Jiayi County's first care center for dementia patients officially opens at Dalian Tzu Chi Hospital. We'll look at why many people do not have access to quality medical services in the Philippines. Welcome to Dai Headlines. I'm Siri Su. Thank you for joining us. Upon their arrival in Turkey, staff of Tzu Chi Foundation visited Sultan Ghazi's mayor and education bureau chief on the next day. The two government officials have visited Master Zheng Yan in Hualien before and are familiar with Tzu Chi's principles and missions. Therefore, Tzu Chi volunteers in Turkey try to help Syrian children pursue education. They've given much-needed help, including assisting with the preparation of the new school building for Menaheim Primary and Secondary School. Meeting staff of Tzu Chi Foundation who have traveled from Taiwan to Turkey, the mayor of Sultan Ghazi is extremely delighted. The mayor, who said that he's also a Tzu Chi supporter, has given Tzu Chi much help during the preparation of the new Menaheim school building.
Thank you to Master Zheng Yan, Mr. Liu, global Tzu Chi volunteers and supporters of Tzu Chi. There is everyone's love in every part of this school.
Having the support of the mayor, Tzu Chi staff and volunteers have become more confident. They also visit the Education Bureau chief.
Tzu
Chi has been carrying out its education mission in Sultan Ghazi for a period of time. It is very important. We are very fortunate. The Syrian people are also very fortunate. Thank you, Taiwan.
Without their assistance, even if we want to help those in need, it would be difficult for us to carry out the work.
To help Syrian children pursue education, Tzu Chi volunteers have been to places seeking local support. Their hard work and sincerity have deeply touched the government officials. Dementia continues to be on the rise in Taiwan. The Ministry of Health and Welfare has decided to set up 20 centers to take care of those with dementia across Taiwan. The first such center in Jiayi County was established at the Dalian Tzu Chi Hospital.
Jiayi County Commissioner Helen Chang and a medical team from Dalian Tzu Chi Hospital have come together to unveil a new center to help those suffering from dementia.
The Jiayi County government and Dalian Tzu Chi Hospital, we have applied for $150,000 from the Ministry of Health and Welfare. The first center is in Dalian Tzu Chi Hospital for the establishment of this center to treat elders with dementia.
If it is a routine case, then when they go to the hospital for a diagnosis, we will undergo a thorough check along with computer tomography and a blood check. This could involve 4 to 5 trips to the hospital. All people can make so many trips, so we have arranged a special time for them to do a more complete diagnosis.
For patients suspected of suffering from dementia, Dalian Tzu Chi Hospital has established a dementia care center which plans for rapid screening at these outpatient clinics. They hope to be able to complete such diagnosis in one day. Furthermore, they hope to integrate community resources to encourage patients to take part in classes. For example, Mrs. Xie, who suffers from dementia, will be given a chance to not only control her illness, but also learn new skills.
Going to these community classes allows these instructors the chance to teach her how to write her own name.
As Taiwan's population with dementia continues to rise, the Ministry of Health and Welfare has plans to establish some 20 different care centers for elderly people suffering from dementia. They hope that such a move to help those with dementia will help lessen the burden felt by their families.
Over 10 hairdressers usually go to Taichung Tzu Chi Nursing Home to give free haircuts to the residents. Close to 300 people live there, and most cannot move freely or are bedridden. To appreciate the kindness of these hairdressers, the nursing home awarded them with a certificate.
Over 10 hairdressers go to serve the residents at the Taichung Tzu Chi Nursing Home once a month.
It can keep my hair tidy. She's skillful.
Most of the 300 residents in the nursing home are elderly who require wheelchair to move around.
Their gestures may be small, but they're very considerate and make us feel very warm.
The haircuts makes the elderly feel comfortable with their looks and minds.
52-year-old Xu Meiyuan is giving a haircut to one elderly who is bedridden due to a serious illness. She has over 30 years of experiences and she has never missed one free haircut day.
It isn't easy for them. My father had tracheotomy for years.
So when I see them, it reminds me of my father.
Her parents had lived in nursing homes before, so she serves them with understanding.
I repay my parents with the body they gave me, so I want to pay back to my parents with the merit I make.
Taitung Tzu Chi Nursing Home awards a certificate to each hairdresser for their regarding the elderly as their family members. Each certificate represents blessing and gratitude.
In our next report, we meet an extraordinary father who lived a difficult life when he was young. About 10 years ago, his daughter got into a serious car accident, and he was told she might remain in a persistent vegetative state. Not giving up hope, this father stayed by the side of his daughter, singing to her, and miraculously, she woke up.
When I go out, people tell me, "You found your daughter." I say, "Yes, I found her."
10 years ago, Yang Huru's daughter was in a car accident, suffering head injuries, subarachnoid hemorrhage, and respiratory failure.
The neurosurgeon told me that she would not wake up, and I must be prepared mentally.
Back then, it happened to be Tomb Sweeping Day.
Seeing people sweep their ancestors' tombs, I thought to myself, my Ya Chun might be sent over here in a few days.
Back then, Yang's daughter's outlook was that of a persistent vegetative state. Yang held back his tears and sang Buddhist songs to his daughter.
Without my parents' care for me, I would not have gotten better. When they helped me undergo rehab, it was as if I was a soldier undergoing training.
To help Ya Chun come into contact with the crowd, Yang often takes her abroad.
We brought our wheelchair when we went to Kyoto. We also brought the wheelchair when we went to Hunan.
66-year-old Yang runs a factory. He was impoverished when he was little and had to work part-time as a student.
Without scholarship, I could not go to school, so I told myself I must get first place. I also worked very hard. Since my family is impoverished, I've always wanted to live a better life.
Working hard and finally running his own business, Yang then faced his severely injured daughter. Staying strong, he keeps telling himself some words.
When we encounter difficulties, we cannot give up hope.
爸爸，我爱你，爸爸，我爱你。
In our continuing series of reports about Asia, we'll investigate the Philippine medical system. The Philippines has a special phenomenon where private doctors operate within a hospital and they are not staff of the hospital. This means they receive no salary and most rent hospital or clinic space. Some say such commercialization of the medical services can lead to ethical problems. Follow our report as we learn more.
In the Philippines, medical care is a luxury for many people.
Last time I went to the hospital, maybe 3 years ago.
The Philippines has more than 7,000 islands, with a small island such as Olango having only one hospital. It is relatively expensive for the local population to see a doctor. Typically, it is only done as a last resort. Many may simply go directly to the pharmacy to buy medicine.
This whole island only has a public hospital and one doctor to take care of more than 15,000 residents. The hospital doesn't even have surgical equipment.
Some people who cannot go to city, and then they will just go home, and then later on, some of them died.
In Taiwan, residents are blessed with good healthcare services. In the Philippines, however, many people who are sick still can't access medical treatment.
There are a lot of medicines that may not be covered by PhilHealth. But one improvement recently is that most cancer medications are already partly shouldered by PhilHealth.
Because one has health insurance doesn't mean that the needs of the people can be met. In fact, in the Philippines, the medical profession has become quite commercialized.
The extent of commercialization of the Philippines can be seen as this large hospital resembles a shopping mall, where many doctors rent or purchase individual clinics. There's no need to pre-register, as one can simply line up to see a doctor.
Amount is, it ranges from 30,000, I think.
30,000.
And above. Depends on the number of doctors in the room.
This hospital corridor is similar to a busy street with more than 1,000 doctors. Each has set up like an individual business. They are not hospital staff and don't receive salaries from the hospital. To see a doctor, one just lines up with no need to take a number.
There's no rule, there's no policy. Right.
At the same hospital, when treating the same disease, one may be charged differently. This is accepted and doesn't come as a surprise.
Of course, they may charge, for example, 400 pesos.
According to Dr. Cuenca, for a minor illness, doctors' fees are generally about $10, with his fees between $8 to $15, and some doctors charging as much as $18. This doesn't include the cost of medicine, along with exam and other miscellaneous expenses.
We have that also for the visual inspection with acetic acid, or the VIA, okay, and but not for ultrasound, because ultrasound is a specialized procedure.
In the Philippines, the current day wage is 500 pesos, or the equivalent of $10. Therefore, to see a doctor could cost a person 1 to 2 days of wages. So what do poor people do when they are in an emergency situation? Actually, they go to cheaper public hospitals which are overcrowded. However, such a difficult circumstance leads many to simply give up on seeing a doctor. This is a dialysis center established at the Metropolitan Medical Center by a Taiwanese person. Nian Caixin says that outsourcing such medical services in the Philippines is very common, and they were one of the first to enter this market and seize this opportunity.
I believe that we are one of the first Taiwanese company to provide medical service in Southeast Asia.
Dialysis machines run day and night as 30 patients can be treated in one day. PhilHealth covers 90 dialysis treatments a year, which means coverage for 8 months. With a population in the hundreds of millions, some believe that there are many more than the reported 30,000 people in the Philippines which need dialysis.
The country's economy is improving, and if health insurance improves, more patients will have the opportunity to undergo dialysis.
This is a story about future vision, or selling shoes to Africans, as one should not look at the past but to the future. Caixin is bravely entering the Philippines market and utilizing his Taiwan experience.
The first thing one needs to understand is the healthcare system and differences related to medical insurance in the Philippines.
In any case, going into business or the medical community in the Philippines is much different than Taiwan. When we put our trust in the hands of doctors, they must also be properly aware of the true value of human life.
Now, however, there are doctors who just like to earn money. They just go to private hospital. They don't have to go to university. It's a little simple life. Measurement of doctor success is not only getting money. You must remember that. It is also service to the community.
Perhaps this is the answer that we are looking for between the delicate balance of healthcare for the community.
In China, Tzu Chi Care recipient Cai Jixian lives with his 81-year-old grandmother. After a daily dose of the ITV, the pair have picked up some good habits, including doing recycling and donating to their bamboo coin banks. More recently, the grandmother has also stopped eating meat. As the volunteers know, it's difficult for such an elderly lady to take care of a disabled person. They visit often to bring love and care.
Leaving his wheelchair to climb over the threshold and sitting back into the wheelchair, Cai Jixian doesn't find his life hard at all. Instead, he takes the time to ask after the Tzu Chi volunteers.
What did you see on TV informing you that we were busy?
After his haircut and before his wash, Cai kneels down and with his hand in prayer, thanking the volunteers for this service. His 81-year-old grandmother's heart is filled with gratitude seeing the volunteers' efforts.
Look at how nice everyone is to you, like your own elderly, helping you wash your hair and cut it. He's unable to leave the house often, and it's difficult to go to the barber shop. I'm still physically able, so I can take care of him. I don't want him to be at a nursing home. I can cook for him, which is better.
The two watch the ITV daily and have picked up the good habits of doing recycling, as well as donating to their bamboo coin bank. Speaking on the topic of vegetarianism, the two are also jumping on the bandwagon.
I haven't eaten meat for a few days. When I cook bitter gourd, I throw an egg in there. But that's it. I haven't eaten meat nor fish. I don't eat that, and neither does he.
There's no bitterness in Cai's heart as he keeps his mind pure by watching the ITV.
In China, volunteers from different places recently traveled to Inner Mongolia to help hold the first tea gathering in Xilhanat. At the tea gathering, volunteers shared their Tzu Chi experiences and introduced the use of bamboo coin banks to the attendees.
You put your money in here, drop a coin in here every day, and then donate this to help other people.
The little girl is very curious about the coin bank. At the first tea gathering in Inner Mongolia, Xilhanat, Tzu Chi volunteers shared a spirit of disaster relief with more than 70 local residents.
I've witnessed how Beijing's kitchen volunteers work from the morning till late in the evening.
As volunteer Liu Huili shares about her Tzu Chi experiences, members of the audience are deeply touched. Volunteers from Xiamen, Jilin Province, Changchun, and Inner Mongolia, Chifeng, have all come to Xilhanat to help with the tea gathering. Traveling from Changchun and arriving on the day of the event, Tzu Chi volunteer Liao Mingren gives everyone guidance. Having learned more about Tzu Chi's principles, the attendees leave the tea gathering ready to dedicate themselves to more meaningful work. Kaohsiung's Jingsihao occupies around 3.3 hectares of land, and close to 2 hectares are gardens paved with interlocking bricks. A group of volunteers will use brooms and other tools every morning to clean the garden and the bricks. When a typhoon is approaching, they will also tie trees with ropes to prevent them from being uprooted.
Why are they eating a cake together? 86-year-old Zhang Xianjing is talking with laughter with young people. He has been working for 4 hours today already. He is close to 90 years old and he enjoys sweeping fallen leaves and cleaning up the garden. Wu Guan is 78 years old. Every interlocking brick surrounding the Kaohsiung Jinsi Hall has his fingerprints on it because he has fixed many of them when they were damaged. Wang Qinglong is mowing the lawn. He once owned a business.
Now my son runs the shop because he's in charge, so I can come here to volunteer.
These volunteers have been giving much help to the Kaohsiung Jinsi Hall. To thank them for their help, we brought a cake to celebrate.
Like a father protecting his family by shouldering all the responsibilities, these 12 volunteers take care of the area that is close to 2 hectares big. The work is not easy, but they never stay away from it.
In recent years, there has been an increased interest in studying the Chinese language worldwide. Taiwan's Ministry of Education has been promoting Chinese education for 8 years since 2013. All of the programs have shown positive effects. Therefore, this year, the Ministry of Education collaborated with the Tourism Bureau, as well as Small and Medium Enterprise Administration, to promote a program entitled Mandarin on the Go in Taiwan. It is hoped that this program can attract more foreigners to come to Taiwan to learn Chinese.
我是来自美国的韩可雷。大家好，我是来自越南的陈金辉。欢迎大家莅临学华语游台湾。
Speaking fluent Chinese is not a challenge for these foreign students, as they think the fastest way to learn Chinese is to fully integrate into life in Taiwan. Therefore, the Ministry of Education collaborates with the Ministry of Transportation and Communications, as well as Small and Medium Enterprise Administration, to promote the program entitled Mandarin on the Go in Taiwan.
Through visits to cultural areas or unique industries, foreigners can experience the food and culture or even the shopping available in Taiwan. We hope we can expand the contents of the program after a year of trial, and later we will invite a variety of schools to design different courses.
I can learn Chinese faster by traveling around Taiwan because I have the chance to contact the environment of Taiwan. In addition, I can also learn Taiwanese culture.
Currently based on local characteristics in different parts of Taiwan, Tamkang University, Zhanghua University of Education, Sun Yat-sen University, and Tzu Chi University have been invited to promote local cultures and lifestyles with shopping, food, cultures, and environments.
As for Aboriginal tribes, we'll take the students to walk into the tribes and walk on the Old Trails Road and learn archery. As for Hakka culture, we'll provide them with a chance to learn how to make Hakka food. If we contact with the Tzu Chi team, we'll integrate Tzu Chi's humanitarianism into the event, including volunteering activities.
Providing foreigners a chance to learn Chinese through experiencing local characteristics, it is hoped that this program can help create more opportunities and business at tourist attractions in Taiwan.
In Malaysia, a lot of people are educated in an English-speaking environment. Therefore, to introduce Tzu Chi to people who do not speak Chinese, Tzu Chi Kuala Lumpur and Selangor chapter held a one-day camp in English. We'll leave you with these images at the end of our program. Thank you for joining us. Goodbye.